This is the EPICC-COVID19 Introduction to Hemodynamics. My name is Alan Lai. We're going to be talking about what makes up cardiac output. The first component of cardiac output is the pump, which is the heart. The second component is the tank, or how much total circulating volume there is available. The third component are the pipes, or the blood vessels. Lastly, the fourth component that makes up cardiac output is the heart rate. These four concepts together give us cardiac output. We'll be using the oxygen supply demand framework to guide this conversation. It can be found on the EPICC-COVID19 website. You can follow along in the red shaded area on the framework. We're going to start with the three components of stroke volume. First, let's dive into the pump, which is the heart. Its main job is to pump blood around. Its ability to pump is dominated by a number of issues, but more so by a pre-existing disease such as reduced ejection fraction. To function properly, it needs just the right amount of squeeze. When we talk about the tank, we are referencing preload. Preload is a result of the total circulating volume within the vascular space. We often modify preload by giving IV fluids or blood. The last component of stroke volume are the pipes or blood vessels. The pressure within the pipes is called afterload. The higher the afterload, the higher the blood pressure. The most common drug we use to increase the squeeze is norepinephrine. The pump, tank, and pipes contribute to stroke volume. The last component of cardiac output is the heart rate. The heart rate typically goes up in times of decreased stroke volume, and the body tries to find just the right rate to balance cardiac output. So let's summarize. The pump is contractility, the tank is preload, the pipes represent the blood vessel tone, which gives us the stroke volume. The final component in cardiac output is the heart rate. That's all for now. Thank you for listening.